Hi, I'm Charmaine James, and I'm here with Dr. Lewis, and we're going to be talking about x-rays and when they show a problem, when they don't show a problem, and when to maybe use the MRI or ultrasound. What do you think, Doc?
Well, x-rays have been around a long time. They've got their place. Do they show a problem? Usually, always. The big question is that what you see on the x-ray mean anything? And I say that kind of in jest. We do find a lot of things when you x-ray a horse that you start scratching your head. You call it an abnormality. Does it mean anything? I think you have to remember that as a horse ages and gets older, particularly a horse that's been performing all his life, they're going to get changes on x-rays. They're not going to look pristine. And you have to sort through that as to significance. It still has to tie back to that clinical exam of that horse, physical exam, and also the history of that horse. You know, what's that horse been doing the last couple of years, last year, last 6 months, last couple of months? How's he been performing? He or she been performing? The horse working well? But x-rays are great for showing changes in bone. They don't tell you much about soft tissue. Diagnostic ultrasound is what you need for most soft tissue injuries to evaluate them. There are areas you can't x-ray very effectively, the upper body. Nuclear scintigraphy, you know, if you have a horse that has problems and you're looking for things, if you get into those areas of the horse, then chances are nuclear scintigraphy is another option. To explain that really quickly, it's a chemical. It's labeled with a radioactive isotope that, and this chemical tends to concentrate and inflame bone, and so you inject that into a horse and distributes itself through the body, and they use a gamma scanner or a gamma camera, and it basically counts the radiation in a certain area, and what you find is they call them hot spots where this stuff tends to accumulate. Tells you you got some bone inflammation in a certain area. That's another form of imaging. MRI is new, but it's good. It's very specific for an area. In other words, you have to zero in on an area and pick the area you're going to scan with an MRI, because your field that you're looking at is limited, where you really focus in on. But it gives a lot of detail that you're not going to get from any other imaging, particularly in bone, the amount of fluid in bone, for instance, those kind of things. They can actually pick up some abnormalities in cartilage that cartilage you're not going to be able to evaluate on x-rays, for example. Some cartilage surfaces you can see with ultrasound, but some you can't get to. It just won't. Certain joints you can't penetrate that deep with an ultrasound to look at them, and MRI can give you a look at that. So all of them have their places. X-rays are still very useful.
And I think that's, a lot of people say, well, my horse has got this wrong, but if, you know, when the x-rays look terrible and then that horse goes pretty good. Scamper was definitely example of how, not x-raying well, but had a lot of longevity, and actually was fairly sound, you know, for the most part, without a lot of, he didn't have a lot of injections, and, you know, we did a lot of icing, a lot of sweating, and, you know, a lot of physical therapy on him. But, and I think for those young girls coming along, you know, when the vet looks at the horse, well, you got a little spur, a little chip, you know, that's not the end of all. It's just something that you need to be aware of so you can help maintain that horse, right?
That's right. And some of the things you're going to see on x-rays, the truth is some of them are clinically irrelevant. Just because it's an abnormality on the x-ray doesn't necessarily mean it clinically causes any symptoms in that horse. You have to put all this stuff together and weigh it as one, the physical exams and everything that goes with it, and the x-rays with that. And so don't be alarmed about some of the abnormalities that are noted on x-rays. The important thing is for a veterinarian to tell you the significance of those things.
I agree. Okay,
Yeah.
thanks.